Hello, welcome to any community. In this particular video, we are going to discuss Shrotrendriyataha Pariksha, one of the type of Pratyaksha Pariksha. When you think about Shrotrendriyataha Pariksha, the clinician uses his ears or Shrotrendriya to do the Rogi Pariksha as well as Roga Pariksha. Text says, Tadyatha Antrakujanam Sandhisputanam Anguli Parvanam Cha Swarabhisheshamsha Echanye api Keti Sharira Upagataha Shabdaha Sistan Shrotrena Pariksheta. So here, Chakrapani says, Anye Picheti Kasahika Shabdadaya. In the sense, we are going to look into, split this particular above said shloka. Tat Yatha Antrakujanam Sandhisputanam Anguli Parvanam cha. Anguli Sandhisputanam Parvanam Sandhisputanam Swara Visheshan cha. Echa Anye api Kechit Sharira Upagataha Shabdaha Syuhu Tan Shrotrena Pariksheta. So here Anye api cha iti Kasa Hikka Shabdadaya. When you think about the Antrakujanam, so that is referring to gurgling sound present in the abdomen. Normally, person is going to take the food. Immediately, if the person is going to move his abdomen, there will be the sounds that will be observed. That is considered to be gurgling sound of the abdomen. If that is being observed after a matter of 2 or 3 hours after food intake, that indicates the person may be having the obstruction at the pyloric antrum level. Suppose if it is being observed at the distal to pyloric antrum, we are going to suspect there may be a possibility of a small intestinal obstruction as such. This is what we can say Antrakujanam. Sandhisputanam Anguli Parvanam cha. So that means the person will be having the sound while moving the joints. Maybe the fingers or maybe the joints as such, or other sounds produced. For example, in case of the hiccup, that means hiccup, what kind of the sound is being produced, or the person who is having the cough, what kind of the cough that will be, what kind of sound is there is being produced, whether is it dry or whether is it productive, that can be very well identified. Dry in the sense there may be a possibility of Vata dosha dominance, and when there is productive sputum in the sense, so that can be considered to be Kapha dosha dominance. That can be easily identified when a person is having the cough. So hoarseness of voice. So whenever a person is having cough, he will be having the, what do you say, that hoarseness of the voice. That means vocal cords that will be dysfunctional. So that is indicative of Vata dosha dominance. And abnormal breath sounds and heart sounds also, which are being examined by the stethoscope of the keeping the stethoscope on the chest, hearing the sounds. The take-home messages from today's discussion are: ear of the clinician is used to hear the abnormal sounds as well as normal sounds produced in the patient's body, such as lungs, heart, or abdomen. With the help of stethoscope, we are going to observe these kinds of the sounds, specifically heart sounds, lung sounds, as well as intestinal sounds. This will be helpful in determining the respiratory disease, cardiac disease, or the alimentary canal dysfunction. Dear ANA community, that's all for today. What are the major key takeaways from today's discussion? Mention in the comment box below. And what is the one video that you'd like to hear in this particular channel? Mention in the comment box below and spread this particular to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. That's all for today. Something more in the next video. Thank you.